Polynesian Paralysis, the sensible approach to mindfulness. In this video, we're going to look at the book, Marijuana, written by a doctor, Edward R. Bloomquist. The second edition of this book was published in 1971 with the subtitle, The Second Trip. Who was Dr. Bloomquist? Edward Robert Bloomquist was a medical doctor, anesthesiologist, and educator. He was born March 12, 1924 in Iowa City, Iowa, and attended Andrews University and Loma Linda University. After finishing medical school, Dr. Bloomquist was a resident anesthesiologist at White Memorial Hospital in Los Angeles. He was an associate clinical professor of anesthesiology at Loma Linda University and later at the School of Medicine at the University of Southern California. Dr. Bloomquist was married and had 3 children. From the cover of his book, Marijuana, The Second Trip, we find the following information about Dr. Bloomquist. For 20 years, Dr. Bloomquist has researched the phenomena of drug abuse and the drug counterculture. As a doctor, a parent, a narcotics consultant, and a friend of youth. A specialist in anesthesiology, the branch of medicine that emphasizes the clinical aspects of pharmacology, he has been a member of dangerous drug committees and advisory panels for the American Medical Association, the California Medical Association, the Federal Bureau of Narcotics, and law enforcement agencies. Presently, in 1971, Dr. Bloomquist was the chairman of the California Interagency Council on Drug Abuse. He has served as an expert witness for the courts and legislatures for several states. Because of his unusual rapport with young people and his extensive knowledge of drug abuse, Dr. Bloomquist is in great demand as a lecturer and radio and television panelist. His enthusiastic audiences range from elementary school children to congressional bodies. Marijuana, The Second Trip, is the second edition of the bestseller and reflects Dr. Bloomquist's empathy for youth as well as his extensive research into the effects of drugs on the human body. So although I have stated many times that Polynesian paralysis does not involve any drugs or medicines, not even marijuana or CBD products, Dr. Bloomquist does include the term Polynesian paralysis in his book about marijuana. In the chapter on pleasant effects of marijuana, page 84, Dr. Bloomquist refers to another medical professional, Dr. Sheldon Choust, who was a psychiatrist and writer and proponent of legalized cannabis. According to Dr. Choust, an adult using weed turns off adult reality and becomes like a child. The mind becomes free with no responsibilities. Dr. Choust believed that marijuana was the fountain of youth and did not cause any harm. Dr. Bloomquist did not agree and asked the following question: how far can one go with cannabis before an irreversible disorientation and disassociation takes over? For even reality, not to mention fantasy, can dull the spirit, as the syndrome of the so-called Polynesian paralysis. This form of indolence affects many visitors who stay too long in the South Pacific. So the use of the term Polynesian paralysis in this book implies that both Polynesian paralysis and marijuana can cause a person to relax. This may be the only thing that Polynesian paralysis and marijuana have in common. Dr. Bloomquist also implies that Polynesian paralysis is a form of indolence or laziness. This is not correct. It may appear to some people, such as Dr. Bloomquist, that someone experiencing Polynesian paralysis is lazy because they're sitting still, when in reality, they are just relaxing and enjoying life. Although Dr. Bloomquist is a medical doctor, there is no evidence that Dr. Bloomquist ever visited Hawaii or experienced Polynesian paralysis himself. This video has been brought to you by RX Aloha. For more information about Polynesian paralysis, please visit our website at rxaloha.com or listen to the Polynesian Paralysis podcast on your favorite streaming platform. Until then, please take a few minutes each day to be still, relax, appreciate nature, and enjoy life. Enjoy Polynesian Paralysis, the sensible approach to mindfulness.